In Buckinghamshire, our population is increasingly ageing and more people are living with multiple long-term conditions, which is increasing demand. So that means we need to do things differently. To be able to do that, we've been focusing more on supporting more people in the community and increasing our focus on prevention, with a particular focus on Start Well, Live Well and Age Well.
The purpose of the Start Well programme is to ensure that children get the best start in life. We know if we get pregnancy and the early years right, then it reduces health issues throughout the whole lifespan of that individual.
On the 1st of June 2023, we launched our in-house smoking cessation service. Our maternity tobacco dependency advisor sees all women who book their pregnancy at BHT and offers them stop smoking support and quit aids like nicotine replacement therapy, as well as vapes as well. We know that smoking in pregnancy is the leading modifiable risk factor to prevent stillbirth, preterm birth, sudden infant death syndrome. So we've still got lots more to do. We still want to reduce the percentage of women that are smoking in pregnancy and at the end of their pregnancy, and also postnatally as well, because we know the harms to the baby as well.
We launched Chat Health about 12 months ago, but since then we've been doing ongoing collaborative work with our children and young people centres, other local services as well, and sort of taking opportunities to promote lots of lunchtime events, going to the schools, doing lots of community events as well, working with our family centres, and alongside the the websites that we've had, Health for Kids, Health for Teens, we've also got a Health for Under 5s website as well now to support the health visitors and really achieve that Start Well element.
We've launched the Chat Health service, so we'll get teenagers messaging about different things they may be going through. So sometimes it might be anxiety, it might be self-harm, it might be friendship issues. We'll just do a little talk with them, or we may invite them to see one of the school nurses.
We know having a high cholesterol is linked to having further cardiovascular events, so further heart attacks and strokes if you've had one in the past. We've used an innovative population healthcare tool. That tool looks at the shared care record, so that's the information we share between ourselves as the hospital, but also our primary care partners and GP practices. We pool all of that information and we're looking for patients who have got a high cholesterol and a history of cardiovascular disease. For those patients, we call them in, we send them a letter and we explain that we want to talk to them about ways we can reduce their risk of having another cardiovascular event in the future. And in that way, we hope to reduce their chance of having that event by reducing their cholesterol with a range of medications which are approved for use on the NHS.
We're one of the first trusts to adopt an AI system to help fast-track patients with skin cancer for treatment.
Over a decade, the number of referrals that came from primary care into BHT, it was 300% increased, and that's not sustainable. And the problem is that that's increasing year on year on year. And so we needed to be able to come up with a solution that helped support our dermatology and plastics colleagues, as well as our primary care colleagues, in order to make sure patients are seen as quickly as possible. We're really proud that we were chosen by NHS England as one of only 7 sites through the country to evaluate skin analytics and their Derm AI platform.
When the patients had their referral, they come to see us at the Telederm clinic. We do some specialist dermoscopic imaging, and then we're also able to offer them the opportunity to have the images done using the AI system with skin analytics. We can then directly upload the images straight from the iPhone to the patient's case record. So the AI uses the answers to the patient's questions and the images that we send to make an assessment of the lesion. It will then generate a report that goes to the dermatology team. They are then able to contact the patient and let them know whether they need to come back for any treatment or any surgery, or if the lesion's non-cancerous, they can just be discharged back to their GP, or they can go home and not worry about it.
Our new interventional radiology suite is one of only 2 such radiology suites in the country.
What's really exciting about this is the AI package it comes with. So we're able to do 3D spins at a really low dose, then imports to our machine, and using AI software helps us develop trajectories and identify biopsy sites. It allows us to push the boundaries of interventional radiology. We're able to reduce the dose to patient dramatically. we're developing new procedures, and it's really aided us in giving the best possible experience to patients. And I really feel we're making a difference here with this equipment.
Our new dedicated telepods, these are confidential spaces, they are bespoke built. The really great thing about this is for patients is they don't have to come into the hospital, and it's a nice space to work for a couple of hours as well.
It's not only inside hospitals that we're changing the way healthcare is delivered, but in the community and on the high street too.
We've got people coming in and out, the public coming in and out of here all day long, and there's just so many opportunities just to say to them, to signpost them to bits of information or to services or to do their blood pressure, ask them to go on the Pump It Up kiosk to find out what their BMI is, find out what their blood pressure is on that. And a particular gentleman came in, and when I told him about the Pump It Up kiosk, he was really interested, and actually his blood pressure was really high. I would really advise you need to actually go to your doctors today if you possibly can. He came past about a month later and said that he'd been to his doctors. The doctor was really concerned about his blood pressure, and he's now under the cardiac team at the hospital.
We're making sure people get the support they need to live independently after illness or later in life, and to age well.
If people have to wait too long after an illness or stay in hospital, or have a noticeable deterioration in their frailty, then the chances of them falling and requiring hospital care greatly increases. As a result of the changes we've made, we are seeing patients at a stage where they are motivated to consider lifestyle changes, and such interventions at the right time can have a positive impact on being able to age well. I really enjoy helping people to improve their strength and balance and make changes to their lifestyle so that they reduce their risk of falls in the future, they feel more confident, they experience a greater quality of life, they're stronger, they're doing things that they thought they wouldn't do again, they're feeling more confident when they're walking out and about, and just generally enjoying their lives rather than living in fear of another fall.
For some people, it can be harder to bounce back from injuries or illness. We know that if people are to stay long in hospital, this can decrease their muscle strength, decompensate, and it will be harder for them to recover. If somebody comes to ED, they are over 65, they will be assessed by ED and then streamlined to the Freya to SDAC team. Once they are here, we are coming every single day in the morning to prioritize those to be going home earlier, for them to be safely managed at home. So we would liaise with the consultant on duty that day in the morning. And if the person is home by afternoon, we can actually go there and see them home on the same day. Being looked after home means patients are more likely to maintain their independence following an illness. The Freya to Hospital Home team review a patient progress regularly over the telephone or by a face-to-face visit in their homes until they are ready to be handed over back to their GPs.
Our staff and volunteers continue to provide outstanding care 24 hours a day, 365 days a year. We want to celebrate our BHT family and all who support them and say a massive thank you.